Thank you for coming to my session to talk about the role of self-silencing in women as it relates to fibromyalgia. There is an incredible link in the literature to functional somatic disorders with the chronic, widespread pain associated that is so incredibly impactful in the functioning and the life of women and their high rating scores on self-silencing and self-sacrificing. Today, what I want to talk about is how these investigations that have been led by some great researchers such as Bacon and White have shown that adverse childhood experiences can be rated also as incredibly high on these women with fibromyalgia and affect their ability to advocate for their needs, speak up for themselves with their providers, and get the care that they so desperately need. A lifetime of trying to meet what is often called in the literature the good woman standard has taught these women that in order to be socially approved of, belong, get their needs met in any fashion, they need to sacrifice their own voice and their own self. And that to be seen as a valued member of their family, their culture, their community, they need to refer to others as being the authority on their own lives. And so, this low self identity, anxiety, depression, suppression of their emotional reactions and needs, and lack of trust in their own ability to use their own voice and be heard and acknowledged and supported is such a huge part of our work with these women with fibromyalgia. To be aware of this and how this relational trauma and their history of being shut down and not heard or acknowledged impacts their ability to continue the conversation when they see verbal or nonverbal signs that you don't agree or you have a different view. And you, as the professional, have such a powerful position to either encourage these women to say what it is that they are experiencing in the body that they alone live in, or to not express and to defer to you and to shut down their own ability to share what it is that they are feeling and needing. And it's shown throughout this literature that when they can express what they're feeling and needing and be heard and encouraged, and within trauma-informed care, be deferred to as the expert on their own body they live in and what's happening, there's an amazing thing physiologically that can happen. You can help them to regulate their nervous system. You can help them to lower that stress response, lower that inflammation, helping them to express their own needs, their feelings, their guilt, their shame, their anger, their resentments for not being seen, heard, and acknowledged, and that their views and experiences are valid can alleviate a lot of the stress response that's happening throughout their body that's causing that hypersensitivity to pain and inhibiting their neurotransmitters from functioning at the optimum level that they deserve for quality of life and well-being to function. The low self-esteem, cognitive self-efficacy that is intensified by a lifetime of being not seen and not mirrored back to for what it is that they are saying that is valid and needs to be heard and acknowledged has such a detrimental impact on the health of women. And so, if we can support them not to avoid that emotion in order to feel safe, in order to feel like they're going to be treated properly, and we can help them to heal this attachment system that's around self-betrayal, self-sacrifice, self-silencing, and to acknowledge that they have real, valid feelings, concerns, and needs. There is a relational and a physiological and a neurobiological process that can take place that can help these women to heal the signals of pain that are shooting through their body and creating such incredible amounts of stress and distress and suffering. And so, with therapeutic interventions as a care provider that involve being authentic and allowing a space for them to be authentic and express themselves and showing them compassion and showing them that assertiveness will be valued, differing views want to be heard. You can support them in their distress. You can help them to be aware of what their needs are and help them tune into their bodies and what's going to be best for them so that they can be empowered to heal mentally, emotionally, and physically, as it is all so deeply interconnected. Thank you for coming. Thank you for listening. And I hope that you will consider using this lens of patient-centered, somatic-centered, trauma-informed, and relational and neurobiological interconnected healing and recovery process to see these powerful outcomes associated with it in your work with your clients.